Good morning, everyone. Thank you for joining us. My name is Brad Mayfield. I'm the Director of Business Development for Greater Therapy Centers. This is the 17th in our series of webinars that we've been hosting daily. We put these together in an effort to get some relevant information out as we all deal with the COVID-19 pandemic. They've gone very well. And they are all available up on our YouTube channel, Greater Therapy Centers YouTube channel. We also will be posting links on our Greater Therapy Centers Facebook page if you need to check those out there. Couple things, questions. People have already started to type in. There's a question box there that you can see. You can certainly type your questions there, and toward the end of this presentation, we'll do our best to get some answers. It may be best to email Jared directly, depending on our time constraints here, and his contact information will be displayed at the end of the webinar as well. So we'll do our best to answer some questions at the end. Everybody's going to be on mute, so but type away, and if we can't get to you, then we'll try to get you an answer via email. So let me give an introduction real quick. Jared Hall is presenting today. Jared is the West Region Director of our clinics in Bedford, South Lake, Alliance, and Fort Worth. He graduated with his doctorate of physical therapy from the University of North Texas Health Science Center in 2014, and he has worked for GTC since 2015. Jared is a board certified specialist in orthopedic physical therapy from the American Board of Physical Therapy Specialties and a certified strength and conditioning specialist from the National Strength and Conditioning Association. He is an adjunct professor for the DPT program at the University of North Texas Health Science Center, as well as Baylor University's DPT program. In his spare time, Jared likes to exercise. He's an avid reader, and he loves to spend time outside on the golf course. And one other thing he likes a lot is discussing pain and pain science. So I'm going to turn this over to Jared. I'm going to put myself on mute. I will be monitoring, like I said, type away with your questions, and I'll be back on at the end to wrap things up. Take it away, Jared.
All right, thanks for the introduction, Brad. So this is actually going to be a little bit of a new presentation for me in the sense that what I usually do is teach continuing education courses and speak at conferences kind of around the nation and some internationally on the topic of pain. And that sounds like something that should be really simple, but as with most things, the more that you learn about it, the deeper you go, the more complex and gray and nuanced things become. So usually I teach an entire weekend on this subject, and what I've tried to do today was create an entirely new presentation that gives a bird's eye view on in about 30 minutes and kind of offers up some new complexity to the topic and understanding of pain, and gives a very brief overview of some of the key areas that you can utilize to maybe help manage pain a little bit on your own without seeking pain medications and maybe without seeking some surgeries and that sort of stuff. So we'll just go through this. I'll give a little bit of a background on the history of our understanding of pain, talk a little bit about what we know about pain now, and try to correlate that to some other common experiences that you have on a daily basis that might help drive that home and make that make a little bit more sense. And then we'll get into 4 different domains in which you can take control in your life to potentially manage your pain a little bit better and have a little bit of a better understanding of the factors that do and don't influence that. So I want to start by just saying, what is pain, right? The simple answer is that thing that hurts a lot, right? Pain is whatever that feeling that you get that is unpleasant and hurts. And it's really difficult for somebody to describe pain without saying that it's like it's stabbing, it's like it's burning, it's like it's pounding. Pain can mean so many different things, and it can feel so many different ways to people. But what we don't have is a little painometer or painometer that we can stick on somebody's knee or stick on somebody's back that gives us a clear objective reading of what they're feeling. Pain is a subjective report, and it is whatever the person experiencing says that it is. And it's our job as healthcare providers and family members and friends to believe that person when they tell us something about how they're feeling, because there's no way to investigate that and say that what they're saying isn't accurate and real. So if we actually get into a definition version of pain, the premier institution in the world for the study of pain is the International Association for the Study of Pain, or the IASP. And in 1979, and yeah, that's a long time ago, right? That's been several decades since this definition was put in place, and it's still the currently accepted definition that we have. Is pain is an unpleasant sensory and emotional experience associated with actual or potential tissue damage, or described in terms of such damage. And that's kind of a little bit of a word salad, but I want to spend some of the presentation breaking down that definition of pain to help people grasp a little bit more of what it's trying to convey. So, and it's a big step forward from some of the original definitions of pain that we had. The most recent definition of pain that we kind of followed before the International Association for the Study of Pain put out their position statement and definition on pain in 1979 was a model proposed by René Descartes back in 1664. So that's referred to as the Cartesian model of pain. What the Cartesian model of pain suggested was that there were receptors throughout your body that when you experience tissue damage, like this little guy sticking his foot in a fire, it sent messages up through like lever and pulley systems and pistons and that sort of thing inside the body up to what's called your pineal gland or pineal gland in your brain, which during that time everybody kind of believed was the seat of the soul. It was kind of where a person's essence emerged from. So you would get these messages coming up to your pineal gland, and that would be pain. And it was kind of thought that your brain as a whole was just a passive recipient of messages coming from your body. And if you experience pain, it absolutely meant that you have sustained some form of tissue damage, and that the more intense the pain was, the more intense that your tissue damage must have been. So 1 unit or measurement of pain would directly correlate to 1 unit or measurement of tissue damage intensity. And the idea was that the more pain you have and the more intense that pain is, your injury must be significantly worse. So it's a very perfectly linear relationship between tissue damage and pain. But if we come back to this International Association for the Study of Pain definition, I highlighted some things that I want everybody to take note of, and for it to jump out and say, sensory and emotional experience and actual or potential tissue damage. So right off the bat, we can see that this definition takes the Cartesian model a step further. And it says not only sensory information is important, but also emotional, cognitive, psychological status and information is really important for that experience of pain as well. And it goes so far as to say that it's actual or potential damage, meaning that you don't actually have to have significant or notable tissue damage to experience pain. So you don't actually have to have an injury or something wrong for something to hurt. And we're going to talk a little bit more about that, and I think that'll make sense, because at surface value, that kind of probably makes you put up a question mark or a little bit of a red flag from the way that society as a whole thinks about pain and the way that the medical system as a whole kind of looks at, views, and treats pain. But it'll make a little bit more sense as we go. So what I want to do to try to bring that to real life is make the analogy that pain is actually a lot like taste, right? So if we think about taste, we have different receptors all over our tongue. We have salty and sweet and savory or umami receptors and bitterness receptors and that sort of thing. And when we activate those receptors, it sends messages up to our brain. But we also know that if we plug our nose or if we're stopped up and we can't smell food, it doesn't taste the same. Some people that maybe have taken certain medications like corticosteroids, like your dexamethasone or your, derivatives of cortisol and that sort of thing, they might have recognized that that's affected their taste buds as well. So you have sensory information coming from your nose that can enhance or change the experience of taste. You have certain medications that can enhance or change or lessen the experience of taste. And we know that different people respond differently to certain tastes. We know that, for instance, there's genetic variants that make cilantro, which is a really common herb used in a lot of cooking, taste like dish soap. And it tastes terrible to some people, while it tastes delicious to others. I love cilantro. I could just eat this stuff all over everything. And we know that that's actually a little bit of a genetic variant. So uh, my genetics might make some sensory information be experienced significantly different than your genetics. We know that how hungry you are can change the taste experience. So when you're really full, maybe food doesn't taste as good, or you don't think about wanting food, or maybe you don't want that big fat steak after you just finished up a huge plate of fajitas. But if you're really hungry, all of a sudden that taste is completely different. Your body is craving that, it's wanting that. There's been physiologic changes that have occurred, there's psychological changes that have occurred that make that same exact experience, that's the same exact sensory information of eating that steak. It's still the same steak, it still has the same salt content, the same fat content, it still has the same amount of juice, it still has the same flavor, but it doesn't taste the same to you at all because of the status that your body's in right now. um, so maybe your history with a food changes the taste experience as well. So everybody has that one dish that their mom or their grandmother made growing up, and it's like your favorite meal of all time because there's so many positive experiences tied to that. You know, you remember eating that around the holidays. You remember eating that at celebratory meals. You remember, the love that you have for your mom or your grandmother when they made that meal for you. But then maybe you grow up a little bit and you have somebody else come over and you want them to eat your mom or your grandma's thing, or you go to eat somebody else's mom or grandmother's special dish and you eat it and you're like, no, it's not that awesome. You know, it's pretty good, but it's not the way that you, who has this really particular experience and history with that dish, the way that you experience that flavor. So your history with a specific type of food can actually change how much you like it, how it tastes, what it does to you. Um, I know that maybe delayed gratification changes the taste experience a little bit. You know, if you have been thinking about a meal all day long and you've been waiting to a certain time to have it, you've been prepping your mind for it, there's a lot of anticipation, and that anticipation primes your body. You might have heard of Pavlov and his dogs, who Pavlov trained dogs to know that they were going to get food when he would ring a bell. He's a famous psychologist. So every time he fed dogs food, he would ring a bell and ring a bell and ring a bell. And then it got to the point where Pavlov was able to ring the bell and the dogs would start to salivate and they would want food. They would expect food. So what we see here is a stimulus driving a response. And the stimulus is ringing the bell and the response is salivation. Well, that goes to show you that anticipation, learned habits, beliefs, and prior experiences can actually change the way that your body functions in anticipation of things. So if you've learned that a ringing bell means food, you'll salivate. But maybe if you've learned that bending forward or squatting is bad for your back or bad for your knee, you'll anticipate that those things will hurt or not be good for you. And when you do that, your body might release a little bit of stress hormones. It might change the way that you respond to incoming sensory information. You might be a little bit more stiff or guarded or fearful when you go to do that movement because you've already learned through past experiences and through knowledge gained that maybe that movement and maybe that thing that you're about to do could be, scary or dangerous or painful to you. So your body is actually already primed to experience pain in response to that. So it's almost like you could say a little bit of a self-fulfilling prophecy, but I don't want to go so far as to really classify it that way. Let me say the environment changes the way that you taste something, right? So fine dining restaurants absolutely know this well, that if you plate food on a beautiful plate in a really appealing way, and you have nice music playing and you have good lighting and you have a glass of wine or a nice cocktail or whatever it is along with your meal, that creates an entire experience. And that entire experience actually enhances the way that you perceive that food to taste. And you could go the other way and say, well, I'm going to take this really nice food and I'm going to eat it on a paper plate, in a really loud and dirty bus that's traveling down a road with potholes, and I'm eating it, next to some random dude that forgot to shower for a couple of days and he smells bad. Then now all of a sudden that really good food probably doesn't taste quite as good, and it's probably not experienced quite as enjoyably. So environment can also change the way that you experience pain. There's been research studies to show that priming people with certain scary images or even certain colors and that sort of thing changes the rating of pain that they give on a standardized assessment of a pain pressure threshold, which is I'm going to poke you with this little blunt knob and you're going to tell me how much it hurts. And I'm going to use a machine to poke you with that knob. So it's a standardized force. It's 20 pounds of force each time I do it. But depending on, the environment that you're in, how you've been primed leading up to that, poking with the knob will actually change how much pain people report from the same exact stimulus. And that's kind of crazy to think about, that in a vacuum, in a completely non-influenced world, you might say that hurts at a 2 out of 10. But if you've been primed with scary things or certain things that might ramp up your system just a little bit, might get your stress hormones going a little bit, might cause you to anticipate a little bit of discomfort, you might say that same exact 20 pounds is a 4 out of 10 all of a sudden. Or if you're really happy and you're in a good mood, you're in a great environment, and you've been primed that this isn't going to hurt and it's going to be okay, and you know exactly what's going to happen and you're not worried about it, that 20 pounds might actually be reported as a 1 out of 10. And there's a ton of research studies to show this, that the exact same stimulus can be perceived differently depending on the context and depending on the priming that occurs before that. So now let's take this. I alluded to this with Pavlov and his dogs. Like, just thinking about food can cause a physiologic response, right? So I'm not actually eating. The receptors in my mouth aren't actually being stimulated. But when I think about a certain food, like right now, think about, how about squeezing some lemon juice in your mouth or chewing on a lemon rind? If you're watching right now, did anybody start to get a little bit of salivation going in your mouth? Did you kind of feel that feeling back in your jaw, like that pucker up feeling? That's because you have experience with this before, and you've learned that if you eat something sour and bitter, that your mouth is going to salivate. And just thinking about it can actually cause that to happen. It can cause real physiologic processes to change in your body, and from salivation to hormone release to neurotransmitter changes to heart rate changes and blood pressure changes, all of this sort of stuff. And that goes right along with the experience of pain as well. Being concerned about something, bending forward, squatting, going up and down a stair, reaching over your head, whatever it is, being concerned and fearful of that might actually prime your system to be a little bit more responsive, to release some of those neurotransmitters and to release some of those hormones, and to change the way that your heart rate and respiratory rate and your muscle tone is responding, just because you're simply thinking about it. So I like to say that pain is most likely sensory. It's always going to have some sort of sensory component. And that can be nociception, which that's a funny word for the transmission of information up to your brain from little receptors throughout your entire body that are there to sense, strong pressures or inflammation or hot and cold temperatures. Your nociceptors are kind of called your danger receptors, and they're there to kind of protect you and send high threshold or potentially threatening information up to your brain to be evaluated. But there's also immune factors, and immune factors change, how sensitive different tissues are and how your cells work and how, different hormones and that sort of stuff are functioning in your body and in your nervous system. And that changes the sensory information coming up to your brain. And same thing with endocrine factors, and visual input is a big one. How many people have a story about themselves or a friend growing up when you fell down and you whacked your head or you scraped your knee or whatever it was and you jumped up and you felt okay, or the person, your kid, felt okay until they looked down and they saw blood. They saw a bunch of blood, they saw a problem everywhere, and then all of a sudden they freak out, they cry, and they act like they're in a lot of pain. Well, that visual input plays a big role in the experience of pain, and that's been studied quite significantly as well. When you add or remove certain visual inputs to people, it actually changes how much or little pain they experience. And that could actually be a factor, in some research that shows that seeing MRIs and X-rays of the internal structures of your body actually predicts a worse outcome from certain things. So if you have some knee pain and you get an X-ray and that X-ray shows some arthritis and some joint space loss, people actually tend to do a little bit worse after knowing what's going on within their joint, because they've had visual input that they can now call back and visualize and think about, maybe some of what they perceive to be negative going on in their joint. But I don't want to go too far down that rabbit hole. That's not what this presentation is about. Same thing happens for auditory inputs. And a really, really big one is neuroplastic changes. So we know that if you work with your hands, you get calluses. And if you go out in the sun gradually, maybe you get tanner skin. Or if you stay out of the sun or don't use your hands, they get softer. Or maybe you get a little bit, lighter skinned. Well, your nerves change exactly the same way. The nerve endings in your hands, or the nerve endings in your back, or the nerve endings in your knee can actually up and down regulate to become more and less sensitive. So if the nerve endings have become more sensitive in your knee, now all of a sudden the same amount of pressure or the same amount of movement or the same amount of bending and squatting and that sort of stuff is perceived a lot more intensely, because those little nerve endings in your knee have become really, really sensitive. So now they send just a boatload of messages up to your brain because certain changes have happened to your nervous system to make it more sensitive. And that's called neuroplastic changes. And they can go both ways. You can become more resilient and more resistant to certain activities through neuroplastic changes that make your nerve endings less sensitive. And it can go the other way. You can become a lot more sensitive to certain things. And there's a lot of factors that go into that, as far as your immune system and your general health and your level of exercise and how much and what quality you sleep. All of these factors can actually play a role in making those nerve endings more and less sensitive. So we also know that pain is most likely always to involve certain emotions. That could be fear and anxiety. We know that there's a very, very strong positive correlation between depression and pain, and they play off of each other. So we know that people that are depressed actually tend to develop more persistent pain issues. And we know that people that are in a lot of pain also tend to have a higher rate of being depressed. So this is a bi-directional relationship where one can make the other worse and vice versa. So that's why it can be really important to address mental health with somebody that's experiencing pain. And we also know that depression is a risk factor that you will develop pain in the future. So that's something that we really need to keep a close eye on. The same is true of past emotional trauma, things like PTSD. These have a really strong positive correlation with the experience of pain as well. So this is where that kind of psychological and emotional component of pain plays a role, because maybe depression and anxiety and PTSD and past emotional and psychological trauma actually makes your nervous system a little bit more sensitive with those neuroplastic changes. So those are things that we can't just completely ignore when we're looking at somebody that is experiencing pain, and we have to recognize that that might play a role without a doubt. So I say all of that just to show you guys that pain is both sensory and emotional, and to give you a little bit of insight into all of the different factors that can affect how much or how little pain you might experience from certain injuries or from certain changes to your tissue or certain levels of activity. And just keep in mind, this is really only scratching the surface. We could go so much deeper into this, but you guys would be, glazed over and bored. And I'm one of the few people, around that actually likes to talk about the neurophysiology and, all of the crazy little fine details. So I wanted to list a scenario to kind of demonstrate how this might play out. So we have scenario 1 on the left and scenario 2 on the right. And let's say scenario 1 is somebody that's completely in a vacuum. They have a perfectly functioning, normal, healthy body. They have no fatigue. They have no history of genetic variances that might make their system more sensitive. They have no depression, no anxiety, no adverse childhood experiences, nothing. They're a blank slate. And then over here on the right in scenario 2, that's probably more like me and you and the average person. Maybe we're a little bit fearful of certain activities. Maybe we slept really poorly last night. Maybe we have a little bit of immune dysregulation because we're carrying around a little bit of extra body weight, or we have an autoimmune condition, or whatever it may be. Maybe we have some genetic factors that make us a little bit more sensitive. Maybe we're a little bit anxious or depressed, or whatever it might be. We apply an external stimulus, right? And we'll say this time it's stubbing your toe, or getting your toe kind of whacked with a hammer a little bit. The person on the left in a vacuum is very likely to experience a less degree, a lower intensity of pain, because they don't necessarily, they're in a vacuum. They don't have all of these factors going on that can ramp up and wind up and intensify that stimulus coming in from your body up to your brain. So all of these factors that I listed in scenario 2 are research supported factors that can affect the intensity of pain that you have. And if you have a bunch of these going on, it's very likely that your system will be more sensitive, and that same sensory stimulus of whacking your toe or straining your back or getting a little bit of rotator cuff tendonitis or even a small rotator cuff tear, all of a sudden is felt way more intensely. It's way more painful because of all these other factors that are going on along with that. So cycling back around, right? We looked at sensory and emotional experience, and now I want to go a little bit deeper into actual or potential tissue damage. So that might sound crazy that you can have pain from potential tissue damage, but let's take people with phantom limb pain or phantom limb syndrome, for example. Maybe somebody was injured and they lost their hand or they lost their arm. Well, interestingly enough, these people often continue to feel their hand and arm even after it's gone, and they very often have significant pain in that hand or arm. And you might think, well, that doesn't make sense. They don't have sensory nerve fibers going up to their brain. How can they hurt in a hand that's not there? That doesn't make any sense. Well, this could be that potential for tissue damage again. And they can't have tissue damage in a hand that's not there, but that doesn't mean that their brain and their body and their consciousness doesn't still perceive or think that that hand is there, and is very concerned and fearful and unhappy that it's not there. And there's some really interesting treatment techniques for people with phantom limb pain, such as mirror box therapy and mental practice and visualization, that have actually shown to be really helpful, where you can have somebody imagine that their hand is there and go through movements, or you can use a mirror to show a mirror image of their non-involved side that looks like the hand that they lost, and that actually helps to reduce their pain a lot because of the visual input coming in. We talked earlier about how vision is really important, and this is a great example. Another example maybe of potential tissue damage could be the condition of fibromyalgia, for instance. Fibromyalgia is what's called a diagnosis of exclusion, and what that means is that they've ruled everything else out and they can't necessarily find something quote unquote wrong with you, but you have sensitivity and you have pain at multiple places throughout your body. You have difficulty concentrating, you have fatigue, you have all of these symptoms going on, and you get diagnosed with fibromyalgia. And for a long time, the people that had this diagnosis were we'll say not treated fairly in the medical system because we didn't understand enough to help them out. And it didn't make sense to us that they have pain. But now we know that there's some connections between poor sleep, chronic, widespread, maybe neural inflammation, where your nervous system becomes more sensitive due to changes in your immune system. And you get this really low grade neural inflammation throughout your body, which makes those little nerve endings way more responsive to stimulus, like walking and squatting and bending and exercising too much or whatever it may be. And that's actually what leads you to have a lot more pain because your entire system is kind of wound up, it's kind of ramped up. So your cup runneth over really fast, right? You don't have a lot of room within, the activities that you do every day before you kind of get overworked or your system gets overloaded, and those nerve endings really send a lot of messages up to be evaluated, and uh, your body maybe perceives that it's in a little bit more danger or more injured than it actually is because of this sensitivity. And that doesn't mean that fibromyalgia is not a real condition, because it is a very real condition. And that doesn't mean that the pain that somebody has when they have been diagnosed with fibromyalgia isn't real, because it is, and it can be absolutely terrible. But it in the past has not made any sense to us because we couldn't look at a scan, couldn't look at an x-ray or an MRI or whatever it was and say, oh, this is your problem. So that's why I say that maybe people with this diagnosis weren't fairly treated in the past. And there's a lot of conditions that fall in line with fibromyalgia. And like I said, I don't want to get too far down the rabbit hole because we have a limited amount of time on this webinar. But please feel free to reach out to me with emails and questions afterwards, and we can discuss this a lot further. So let's talk a little bit about how common pain is, right? 1/3 of Americans report experiencing chronic pain, and that's higher than any other developed nation in the world. I think it's Canadians are 1/5 and Australians are 1/7, and that's based on the last estimations. And that's really interesting that Americans tend to have more pain than any other developed country, and it's 1 out of every 3 of us are living with some form of chronic pain. And specifically, back, neck, head, and face pain make up 2/3 of that reported pain. Back and neck pain are really common, and it's quite the conundrum when we try to figure out why we as Americans tend to actually have more persistent pain than anybody else. And there's theories that, in general, we're a little bit less healthy. We tend to be a little bit more overweight. We tend to walk and exercise a little bit less. Research that I'll get into in a little bit shows that we have actually pretty significantly reduced the average amount of hours of sleep we get per night from even the 1940s to now. And we know that lack of sleep is a big predictor for making your system sensitive. And my colleague Richard Evans did a webinar on sleep health and sleep hygiene and the impact that sleep has on pain back a couple of weeks ago. And I'm going to touch on that again here in a second. So the cost of chronic pain is pretty mind-blowing as well. So chronic pain, the direct and indirect costs are $635 billion a year in the United States. And that's more than cancer, heart disease, and diabetes combined, which is pretty mind-blowing when you think about how much that costs. But when you understand that 1 out of every 3 Americans has persistent pain, and that certain medications and that sort of stuff are extremely expensive, and of course, surgery is not a low-cost option for people, and the time off of work is very expensive. So that's about $300 billion of time off of work and $335 billion of direct medical expenses. So when people are consistently missing work as a result of that, it costs hundreds of billions of dollars. And that's why I want to talk about this stuff to raise awareness. I want to give people some options of things that they can do to maybe improve their pain and manage things a little bit better at home, so you don't have to miss as much work, and maybe you don't have to seek out as much pain medication and that sort of thing, right? Also, I wanted to point out that because of all of this, 1 to 2% of Americans are dependent on opioids. And it's been in the news, the opioid epidemic and all of this sort of stuff. Over 100 people a day die from opioid overdose in the United States. So it's become quite a big issue because we haven't understood pain very well in the past. And I'm not even going to make the claim that we understand it well now, but what we do understand, what we didn't understand was less than what we understand now. And we were throwing a lot of medications at it, trying really hard to help people feel better. And that led to the opioid epidemic that we're dealing with now, that we're really trying hard to fight against, because opioids can be so damaging and so harmful on multiple levels. So how can I manage my pain without opioids? If we now know that pain is incredibly complex, just from the surface level information that I've covered so far, it has sensory components, it has social and emotional components. Its presence doesn't always represent the state of your tissues, meaning that there's not necessarily damage, there could be sensitivity. Its intensity doesn't reflect the extent of injury, because remember, we talked about how all of these factors can actually change how much pain you report in response to a standardized stimulus. We can explore what and how certain strategies can be helpful for pain management. So I want to go into a little bit of information on sleep, a little bit of information on movement and exercise, a little bit of information on metabolic health and nutrition, and a little bit of information on stress management. And if you guys have been present during a lot of our webinar series that we've been doing with Greater Therapy Centers, you know that we've talked a lot about exercise. In my original presentation, I touched briefly on nutrition information. Richard Evans did a full webinar on sleep health, and Danny Smith did a webinar on deep breathing techniques and stress management and yoga and meditation. So you guys can go back and look at some of the information that they provided for a more detailed explanation of this stuff as well. So let's just briefly talk about sleep and your body. So the average hours of sleep per night has decreased from 7.9 in 1942 to 6.8 in 2013. And I mentioned this earlier, and that's really big. That's over an hour a night of sleep that on average Americans aren't getting now that they used to. And I don't think that it's any coincidence that the rates of chronic pain and the rates of a lot of other persistent health conditions have also gone up at the same time that sleep has gone down. And experimental data shows that when you persistently sleep deprive somebody, their system becomes a lot more reactive and a lot more sensitive. And we know that that affects the way that your immune system functions. And in the middle of a pandemic right now, we definitely want our immune system functioning to the best of its ability. So 40% of people in the United States report that they get 6 hours or less of sleep each night. And I really wanted to put that in there because 6 hours has repeatedly shown up in the research data as a cutoff point under which a lot of issues start happening. They tend to get a lot worse. Your immune system tends to become a lot less reactive and strong underneath that. There tends to be markers of dementia and Alzheimer's disease chronically under that level of sleep. There tends to be weight gain and increased incidences of diabetes and heart disease, heart attacks, and strokes underneath that, and also a really significant increase in the amount of pain that people experience when they're consistently under 6 hours of sleep a night. So I think that that's really important to drive home, and I can't stress it enough. So we know that short sleep is independently associated with weight gain. So if you're consistently undersleeping, you're going to consistently release more cortisol, and you're going to consistently have more issues with the way that your metabolism functions and the way that your body stores calories. It's going to lead to more storage of fat in that chronically stressed situation, because cortisol is the stress hormone, and having less sleep increases cortisol, which means that it is really putting a negative stressor on your body. And I alluded to this a little while ago as well. Sleep deprivation of even just 2 nights in a row has been linked to a 25% increase in experimental pain. And this was really shocking to me when I started reading this research, that you could take somebody that's well rested and you could poke them in the arm again with that blunt object at 20 pounds of force, and they would say, oh, that's a 2 out of 10 pain. Well, you sleep deprive them for 2 nights. That's it, just 2 nights. And when I say sleep deprive, I just mean sleep 4 to 5 hours. I don't mean completely stay up for 48 hours in a row. Just sleep 4 to 5 hours in a night, and you come back and you poke them with that 20 pounds in their arm again. And when they did say it was a 2 out of 10 pain, now all of a sudden they're saying it's a 3 out of 10 pain. It's jumped up an entire another level, which is really interesting, and it drives home the importance of sleep and consistently getting enough sleep. So here's just a brief overview, and this is taken from the National Sleep Foundation, what too little sleep does to your body. It dramatically increases the rate at which people develop and catch colds, right? So again, when we're trying to stay healthy during flu season, during COVID season, getting sleep is going to be paramount to making your immune system as strong as it can be. You tend to have an increased rate of inflammatory bowel disorders and problems with using the restroom. You have difficulty with your memory and learning, tend to be a lot more irritable and have more aggressive mood swings, increases the rates of headaches and migraines, it depletes sex drive, it affects your vision, and it causes weight gain due to some of the factors that I talked about earlier. So there's a really strong bi-directional relationship between sleep and pain, meaning that people that have pain tend to sleep worse, and people that sleep worse also tend to go on and develop more persistent pain issues. So trying to break that cycle is really important. So if you have pain that's keeping you from sleeping, we need to explore ways to get your pain more manageable or change your sleeping habits to break that cycle so it can in turn help your pain, which can in turn help your sleep a little bit. So we know that sleep definitely has a strong relationship to stress. So people who are underslept have more anxiety, they have more depression, they have decreased emotional regulation, and they have decreased regulation of their cortisol levels. So all of these things play into psychological and physiologic stress. And if our body is constantly in a state of being stressed, being under pressure, it's going to be more hyperreactive. It's going to be more responsive. And this can be one of the big factors that plays a role in having more pain when you're sleeping less. So it's a terrible cycle, right? You have worse sleep, which affects your mood, which decreases your activity level, which decreases your energy, which affects your sleep, which affects your mood. So you have this circle, this cycle that we have to come in and try to break that cycle. And like I said, I mentioned Richard Evans did a good lecture webinar on sleep hygiene, and he went through a lot of different factors that you could explore to maybe help you break that cycle and improve your sleep. So let's talk a little bit about movement and exercise. So we know that exercise is anti-inflammatory, and it releases positive little things called cytokines in your body, among other things, growth factors and various other little factors that are released when you exercise that helps to potentially reduce pain. We know that exercise induces analgesia, which means that it lowers pain through a variety of biochemical processes. And we'll talk a little bit about that in a second. So every time you exercise, you can get what's called exercise-induced analgesia. And anybody that maybe has been to the gym or been to maybe a physical therapy session sometimes where you walk in and you feel stiff and you feel sore and you don't feel good, but then you exercise, you get your heart rate up, you sweat a little bit, you do some movements, and all of a sudden you feel a lot better. Maybe you feel warmed up. Well, that's a lot of those biochemical processes that exercise causes to happen that lowers your pain levels. So we know that exercise releases serotonin and dopamine, which improves mood and helps relaxation and fights anxiety and depression. And we know that exercise improves glucose sensitivity or lowers your blood sugar. And we know that consistently elevated blood sugar is very inflammatory to your vessels, to your heart. It leads to poor connective tissue health, connective tissue that's stiffer and more brittle. And overall, it damages your eyes and it damages your kidneys and all of this sort of stuff, which in turn actually make your body more sensitive and more likely to develop musculoskeletal pain and more likely to actually sustain an injury. So exercise actually reduces the rate of injuries and reduces the rate of pain, in part through helping to regulate blood sugar and neuroendocrine responses associated to blood sugar and energy storage. So I mentioned this on the last slide, this exercise-induced analgesia. Exercise actually releases endogenous opioids. So the reason that opioid pain medications tend to be addictive to us and we tend to get dependent on them is because we have a ton of receptors throughout our entire body that respond to opioids. And the reason that we have those is because our body produces our own natural version of opioids. And it does that to help us regulate pain. And it does that to help a lot of processes in our nervous system. And those little guys are released in response to exercise. So if we can gradually build up our tolerance to exercise, we'll release more and more of these endogenous opioids within our own system, which can help to regulate our pain and decrease those pain levels as well. Exercise releases serotonin, which we talked about is powerful for mood regulation. And if you remember back to the beginning of the presentation, I talked about how stress and anxiety and depression and these different factors definitely affect the pain that you come to experience and how much pain you might have. Anything that's going to boost up our serotonin levels can be really helpful. And that's why one of the most common antidepressant medications is called an SSRI, or selective serotonin reuptake inhibitor. And what that does is it lets serotonin stay in your little neural gaps there, right, where you have the terminal button and you have like the neural junction. It helps that serotonin stay in there for a longer period of time, which actually increases your mood and helps you feel better. Exercise also releases endocannabinoids, and we know that CBD has been in the news a lot lately, and we've heard a lot about marijuana and CBD type products maybe being researched for pain management. Well, exercise releases endocannabinoids, which are little chemicals that are just like those chemicals that might be in cannabis that maybe help us feel a little bit better. And those endocannabinoid receptors have been shown to play a role in people's experience of pain. So if you block those, then people don't get as good of pain relief from things that actually release those. So, and that's the same thing with the endogenous opioids. If you block endogenous opioids with a medication called naloxone, which is what they give people to save their lives after they've overdosed on opioids, because it blocks those receptors and it doesn't allow anything to work. If you block those, all of a sudden people don't get pain relief after exercise, which is really interesting. So it lets us know that our body releases those natural opioids and those help to lower our pain after exercise. I've already talked about this a little bit, but if we can help to regulate our metabolic system a little bit better and we can have a little bit better nutrition, there's some indications that this can play a role in decreasing pain as well. So highly processed, highly calorie dense, lots of added sugar foods have been linked to greater levels of systemic inflammation. And we talked about how elevated blood sugar causes inflammation in your blood vessels and it leads to issues in your kidneys and your eyes and your connective tissues. Well, that's because it creates a little bit more inflammation and it makes those tissues less healthy. Excessive body weight has been linked to systemic inflammation and increased pain as well. And on the surface level, you would think, well, of course, extra body weight causes more issues because it's more, quote unquote, wear and tear on my joints. But it actually goes quite a lot deeper than that. And we see that excessive body weight, a lot of extra fat mass, actually releases hormones and releases chemicals that are inflammatory and make you want to gain more weight on top of that as well. And it's a phenomenon called leptin resistance, but we don't want to go too deep into that as well either. Just know that excessive body weight has been linked to increased pain, not only because of the extra physical load, but because of the um, inflammatory aspects and hormonal aspects of that excessive body weight. So, like I just talked about, there is extra mechanical strain, and excessive body weight also impairs sleep. There's a very positive correlation between extra body weight and sleep apnea, and sleep apnea is very closely related with the increased release of cortisol, because you stop breathing and your system kind of jumps and freaks out when you start breathing again, and that releases cortisol. So this consistent cycle all night long of having sleep apnea releases cortisol, which makes your system respond more aggressively, be a little bit more stressed out, so to say, and that cycles back around to make you gain more weight, make your system more sensitive, and then impair your sleep even further. So if you guys can see, all of this stuff is kind of, it's a system that plays off of each other, and one component influences the other component, and that component might in turn influence the first component back again and influence another component. So all of these things are playing off of each other, and it's really important if you're dealing with persistent pain, especially, to look at all of these different factors, or have somebody that's willing to look at all these different factors to help you figure out what things that you can do that might be able to help you, that aren't necessarily jumping straight on pain medication. So, of course, you can focus on your nutrition to try to help your body weight, but I'm certainly no registered dietitian, and I'm not a nutritional counselor, but I did just want to throw some surface level information in here. Focused on whole and minimally processed foods, eat lots of fruits and vegetables, try raw and roasted unsalted nuts as a snack because they're very satiating. Eat lean meats, get healthy fats from avocados and olive oil and salmon and nuts. And I just wanted to briefly look at this slide just so people have a better grasp of what it actually means to lose weight. So this is an oversimplified weight loss chart. And let's assume that your basal metabolic rate is 2,000 calories a day. The average American is said to have, an average of 2,000 calories a day is what we need. So if we look at this, if we can ingest 1,500, or if we can ingest 1,750 calories, and we can not eat 250 calories, and we can burn 250 calories, what that will leave us with is 1,500 calories, which is a 500 calorie deficit per that day. And if you read all of the nutrition research, if you talk to the nutrition experts, the obesity physicians, and the biochemical researchers, at the end of the day, they come down with the simple conclusion, the final answer, that the only way to lose weight is to ingest less calories than you need, or to burn more calories than you consume, right? So you can either be on a diet, or you can over exercise to burn off some of those calories, or you can do a combination of both. But the only way to lose weight is to consume less calories than your body needs on a daily basis. And you can do that through a multitude of different diets, and you can do that through a multitude of different approaches, and you can do that with a multitude of different exercise programs. You just have to find what fits best with you. And ideally, that's making good nutrition choices and reasonable exercise choices. But to come back to this graphic, we know that 1 pound of fat consists of about 3,500 calories. And that means that 3,500 divided by 7 is 500. So if you can be in a caloric deficit of 500 calories a day, that means that you'll lose 1 pound of fat in a week. And that's a safe and healthy level of fat loss. So that means that, throughout the course of a year, you could lose 50 pounds if you stuck to an approach like this, where you ingested 500 calories less than what you need, or you burn 500 calories more than what it is that you need to maintain your weight every day. And 50 pounds less of body weight is an astronomical amount of reduction in the mechanical loading forces to your joints, as well as it's going to dramatically improve the way that your metabolic system functions as far as glucose sensitivity, like diabetes and all that sort of stuff, right? So I don't want to go way too far deep into this, but I just wanted to give an overview, because I find in talking with a lot of patients that on average, people don't necessarily understand the whole weight loss thing and the calories in versus calories out and the various ways that you can approach that. But again, I'm not a registered dietitian and I'm not a nutritional expert, but this is information and research from those people that I wanted to convey in a simplified form. So I did want to give people a few easy options that you can change in your everyday life to maybe help you control your calorie intake a little bit. And that's one common method is to drink a really big glass of water before each meal, because that water fills up your stomach a little bit. It stretches your stomach just a little bit. And we know that there are stretch receptors in your stomach. And when those stretch receptors get activated, then they actually help you feel full and less hungry. So that could be one way to help. Choosing foods like vegetables and nuts that make you feel full for longer. So certain foods have what's called a satiety value. And the satiety value means if I eat this quantity of this food, how long will I feel full? So vegetables with lots of fiber and things like white potatoes without lots of butter and bacon bits and all that sort of stuff added to it actually have really high satiety value. So they'll keep you full for longer, so keep you from getting cravings. Eat more protein. Protein, especially lean, good, healthy protein, has a high satiety value, and it also is really difficult for your body to break down. So when you eat protein, you actually burn a lot of calories in the process of digesting that protein, versus fats and carbohydrates actually don't burn nearly as many calories when you eat them. So just changing the composition of your 2,000 calories in a day to be a higher proportion of protein actually will lead to more calorie burn, just because protein is really hard to digest. Try using a small plate. If you're anything like me, you want to get the biggest plate and you want to fill that plate up and you want to make that plate look really happy, right? Really full plate. And if you are raised like me, you need to finish your plate. You're not done eating until your plate is empty. So using a smaller plate will allow you to put less food on it, and you'll be done with your plate after consuming less food. And oftentimes there's a delay while eating to when you feel full. So oftentimes when you eat, it can take 5 to 10 to 15 minutes to actually start feeling full. So if you slow down your eating and you eat off of a smaller plate, you give that window of 5 to 10 to 15 minutes to actually start to feel full, versus if you have a big plate and you eat fast, you've shoveled all that food in and you haven't allowed time for your body to start feeling full again. So that could be one simple method. Try not to let yourself get too hungry, because when you get really, really hungry, people tend to binge a little bit more. Try not to drink your calories. A lot of people don't realize it, but sodas and fruit juices and Gatorades and that sort of thing have a ton of calories. They might have, 200, 300, 400 calories, depending on how big of a soda or fruit juice that you get. That's a ton of calories. And liquids don't satiate you for very long because they pass through your stomach really quickly. So they'll go in, they'll pass through your stomach. They won't make you feel full, but there's still calories. And that's mostly from sugars, which don't really require any calories to burn. Don't have foods that you can't control yourself from eating in the house. That's the simplest thing. If you're like me and you have that snack that you really like or that guilty pleasure in the house, it's going to get eaten. But if you don't buy it, it's way more likely that it's not going to get eaten. And you can try actually reading food labels and looking at how many calories are in a serving to measure your calories every day for a few days to get a really good grasp on how many calories you consume on average and how many calories are in common foods that you eat. And that really helps you moving forward to just have a reasonable idea of what it is that you're eating. And then, of course, improve sleep. You see how it's cycling back around. So now I want to talk very quickly about stress management. Like I said, Danny already talked about meditation and breathing and stretching to help to regulate your system a little bit. But I wanted to talk a little bit about the sympathetic and parasympathetic nervous system. So your body has this thing called an autonomic nervous system. The sympathetic nervous system is for stress response, and it's often called the fight or flight nervous system, whereas the parasympathetic nervous system is for more relaxation type stuff, and it's often called the rest and digest nervous system. So when your parasympathetic nervous system is rocking strong, you tend to be able to relax, your heart rate slows down, your muscle tone reduces, your body really works on digesting food, and it conserves your energy. When your sympathetic nervous system is going, it reduces how much you digest your food, it pumps up your heart rate, it pumps up your blood pressure, it pumps up your muscle tone, it dilates your pupils so you could fight or run from somebody. And what we know is that psychological stress and physical stress can activate the sympathetic nervous system. So if you're having a lot of stress from, worrying about certain things, or maybe you're struggling with depression, or maybe you're not sleeping well, which activates the sympathetic nervous system, you're going to have all of these things going on. And that's why oftentimes people in persistent pain, especially, have bathroom problems. Maybe they're constipated or they have issues there because their gastric motility actually decreases because the sympathetic nervous system is going consistently all the time, or maybe they feel really tight all the time, or they're really stiff in the way that they move because they have an increased level of muscle tone and muscle guarding because the sympathetic nervous system is going again. Or maybe you have a tough time going to sleep because the sympathetic nervous system is functioning at a higher level. So your body is ready to fight or flee, run away from somebody, but you're trying to tell it to go to sleep. And those things don't jive well with each other. So like I mentioned, stress and anxiety increase the activity in your sympathetic nervous system. And when you're constantly on edge like that, we know that that makes your system more sensitive, and a more sensitive system responds more aggressively to stimuli, and that stronger response to a stimulus can actually lead to significantly higher levels of pain. Sympathetic nervous system releases a ton of cortisol, which we've already talked about, dysregulates sleep and causes you to gain more weight, which cycles back into the metabolic health and the exercise components of things and the nutrition components of things. Increasing the parasympathetic nervous system can be helpful to potentially combat some of these things. So how do I do that? Deep breathing, a technique called boxed breathing that you can jump on YouTube or you can Google up boxed breathing techniques. It's just a breath count and a specific method of going through breathing exercises to help maybe calm you down and regulate your system. Meditation, calming visualization, prayer, a good night's sleep, again, cycle back, and reduce stimulus intake. So caffeine and that sort of thing. So again, Danny did a really nice webinar on deep breathing and meditation and active relaxation. So I encourage you guys to check that out. So in conclusion, we learned that pain is way more complex than we ever thought. And I'm going to emphasize this again. I really just scratched the surface on the depth of complexity that we can go into. We learned that pain is both sensory and emotional. We learned that pain and tissue damage aren't necessarily equal. We learned that pain intensity isn't always reflective of the degree of injury. We learned that exercise reduces pain via several mechanisms like endogenous opioids, endocannabinoids, serotonin release, all of these, and a lot of other factors as well. Sleep has an intimate relationship with pain, and improving sleep can often improve pain. Diet and metabolic health plays a really significant role in pain. So improving your diet and losing excessive body weight can be very helpful for reducing pain. Stress and autonomic nervous system activity can play a role in pain as well. So doing things to maybe address your mental health, like meditation and deep breathing and counseling and these sort of things can help reduce your pain as well. So pain is this really complex biopsychosocial multi-dimensional experience that's not black and white and as simple as we originally thought. So if you are experiencing pain, try to look at all of the different dimensions of your life and see where you can make improvements. And if you can't do that with some of the information that I provided here, then try to find a local healthcare provider that, like one of us here at Greater Therapy Centers, that understands a lot of these concepts and can help work through it with you. And that is the conclusion. So thank you guys for being on this webinar with me. And if you want to contact me, my email address is jhall, that's JHALL, at gtc-pt.com.
Thank you, Jared. Wow, incredible. And I know you worked hard to pare down this very broad topic to make it a little more concise and acceptable for this webinar purpose. So we really appreciate that. Yeah, Jared has told me that he's given 2-day lectures on this topic and probably not even scratched the surface. So there's a lot of information, but we really appreciate you doing this. There were several very, very good questions that came in, but they were very specific and sounds like they probably are coming from other healthcare providers. So to y'all, to the folks that asked those questions, I'm going to get Jared to email you back if that's okay, because I think the detail and the specifics that we would go into there would definitely be helpful for you to understand or get his perspective on, but might not apply to maybe some of the patients and some of the lay people like me who aren't really may not have a full understanding of what you're asking, but I know Jared would love to talk with you about that. So we'll get those to him, and he will email you back. This will be available up on our YouTube channel. It'll probably take a couple hours to process and be put up there. All of the previous now 17 webinars are available on our YouTube channel as well. Just search Greater Therapy Centers. You can also check our Facebook page. All right, well, that concludes the webinar for today. Thank you so much, Jared. We're going to go ahead and stop the recording and then close out the webinar. Thanks, everyone.